If you've spent any time on social media recently, then you know that the word on the street is that Christina Aguilera is looking really good lately. Jessica Simpson looks absolutely unrecognizable. She literally looks like she's 22. And Kate Beckinsale, she literally looks like she's 18 again. How do they do it? What are they on? What are they doing? What's the beauty routine? Where's the fountain of youth? I need the Google Maps location because I want to find it.
I want whatever the fuck Christina Aguilera's on because that bitch has the Benjamin Button effect going on. She is getting hotter with age. Like every time I see a video of her, it's actually alarming because I think it's a 20-year-old.
How does she do it?
Like, what is Miss Girl doing?
Yeah.
I need to be put on.
What are the secrets? And the truth about it is the first time I ever saw those new videos of Christina Aguilera, tell me why I thought it was AI. While some reporters on social media claim that these women are actually not the real deal and that they're clones, which is actually a very scary thought, but I am not here to talk to you about that today. I'm here to tell you the damn truth. If any of you are aware, Miss Christina actually didn't look anything like this a few years ago. In fact, this is the version of Christina that I remember very clearly. A little bit of overfilling, a little bit on the curvier side, and she certainly does not look as ageless as she does today. Look at her! Bro, are you kidding me? And the secret, everyone, it's a facelift. Allegedly, okay? Don't take me to court. But yep, I said it. Yes, it is more common than ever in today's digital era seeing women as young as 25 undergoing one of the most invasive plastic surgeries, the facelift. And today I'm exposing every detail. Everyone, let's buckle up because we're going on a wild ride. A facelift, also known as a retidectomy, is designed to reduce the appearance of wrinkles and sagging skin on the face and the neck, creating a more youthful appearance. Though there are many writings of ancient practices involving early facelifts all the way from Egypt, Rome, and China, the very first documented facelift occurred in 1901 by Eugen Hollander. The procedure involved lifting and trimming loose skin near the cheeks and around the mouth to create a smoother, rejuvenated look. This facelift was quite minimal compared to modern techniques, focusing primarily on skin tightening rather than the deep layers of the tissue and the muscle. The field of cosmetic surgery, including facelifts, really grew in sophistication throughout the 20th century, now focusing on deeper layers of the face to create a more natural and lasting result. Yeah, at this point, they're pulling everything that they can get their hands on to get that snatched, youthful look. Emphasis on snatched. Now, you might look at the incredible results that Christina Aguilera has had from getting a facelift, and you might think it's just a cute little walk in the park with your boyfriend, holding hands, drinking a PSL.
Well, no.
Facelifts are probably one of the most invasive plastic surgeries that I've researched thus far. And let's just take a quick look at how it's performed.
The human face undergoes many changes as we age.
Facts.
The skin becomes thinner, loses fat, and no longer looks as plump and smooth as it once did. Years of ultraviolet sunlight exposure makes the facial skin less elastic, while gravity causes the skin to sag and wrinkle. A facelift can smooth out the facial skin sagging and wrinkling, in particular, the jowl regions and the sagging upper neck. When it comes to facelifts, intimate knowledge of the different layers of the facial skin is essential.
Ooh.
Immediately below the skin is the subcutaneous fat. The fat provides volume and smoothness to the facial contour. Next is a thin fibrous layer known as the SMAS, which stands for superficial muscular aponeurotic system.
Remember the SMAS.
It is a key facial support structure that the overlying skin rests on. Finally, the underlying salivary gland, muscles, and nerves are present. First, the facelift incision is made hugging the ear boundary and hairline. The skin and underlying fat is lifted off the SMAS layer. This skin undermining is performed all the way forward to the eye, nose, and lip, as well as downwards over the upper neck. Strategic incisions are made to the SMAS layer, which is then elevated off the underlying facial muscles. Next, the freed SMAS layer is then pulled both upwards and backwards.
Bro, this is not fun and games. This is not no quick little booty injection. They are ripping your face up in shreds. It is a construction zone.
Please note that the areas immediately around the eyes and lips are not improved with a facelift and require other additional procedures to make them appear more youthful.
That's crazy. You need to get subcategories of facelifts just in order to get the full snatched effect. It's not just going to work with a classic traditional facelift. We're going to get there. We're going to get to all of the different options you have, baby. They literally cut into you and snatch your muscles back. They go, muscles, you've been drooping for a minute. We're going to pull you up out of the gutter. But I guess it all makes sense because if you're simply pulling the skin on top, it doesn't actually target the root issue. Those videos of that animated woman really do not show you the intensity of this procedure, so let's look at what happens to a real person. Day of surgery. Epic facelift 3-week update. No, you guys, she looks like she was in a brawl. She is so bruised and so swollen. It seems like those tiny little incisions and all that seems so simple, but it is incredibly invasive. Look at it, it's only getting more swollen. But I mean, my goodness. After 3 weeks, she did look truly incredible. She was actually unrecognizable that first week. That was crazy. It just goes to show you how swollen and sore you probably are after all of that cutting. Here is another before and after. So you're looking at her right after the procedure. You can see how pulled tight she is. And now we're seeing the before image. I mean, baby butt smooth skin. Look at her face. People typically end up getting back to work within a couple weeks of their facelift. However, you have to be on complete bed rest. Otherwise, honestly, the worst could happen. Like, don't move, don't speak, sleep on your back, be very, very, very careful with your face. This is your face, you guys. But for the entire face to heal, all of the swelling to go down, it can take upwards of 6 months. Now, the perfect candidate for a traditional facelift is someone who has sagging or loose jaw lines, a large number of wrinkles and deep creases, drooping or hooded eyes, sagging facial muscles. And now when you think of these symptoms, we typically imagine somebody in their 50s, 60s? But no, in 2024, there has been a massive boom of specifically young people undergoing facelifts. So this begs the question, did Christina Aguilera actually get a facelift?
Someone needs to investigate Christina Aguilera.
If we take things back to a few years ago, she went through a phase of having too much dermal filler, which gave a pillow face-like appearance, and we can predominantly see this in the mid-face, cheeks, and lips. As time went on, a combination of too much dermal filler and an overall change in her weight led to this facial fullness. If we firstly compare her 18-year-old self to now, changes I can immediately see are her nose, it's much sharper and lifted. She has more proportionate lips, both in relation to the upper and lower lips.
She looks insane, you guys. Like, can you see some differences here with the plastic surgery? Yeah, of course, absolutely. Like, the best injectables are undetectables. They're all detectable, babe. But how can you show a picture of you at 18 versus being in your 40s and look literally like time didn't pass?
I can attribute this to filler and also the dental work as well with veneers. The change in weight in such a short period of time could be attributed to Ozempic use, and I also think she would have dissolved all the filler in her face before then undergoing some surgical treatments.
There's also something to be said about people who overfill and they stuff their face filled with filler, and then you want to dissolve all that filler, like we've talked about in previous filler videos, which I will link here. I have so many of them for you to explore. Once that filler is dissolved, or equally say you have lost a significant amount of weight, that skin will never go back to the way that it was pre-filler. There will be some bumps and lines. A lot of people notice after dissolving their lip filler that their lips kind of appear a little bit saggier, their face appears a lot saggier, which I think is what brings so many people today to going ahead and getting full-blown facelifts.
Most notably an upper blepharoplasty to remove excess eyelid skin, and I think an endoscopic facelift. This is an invasive procedure that involves making incisions within the hairline, inserting a small camera and an endoscope to reposition facial tissues and muscle. One of the telltale signs of this procedure is the lifted brow and shape of the eye. It gives a much more sharper look.
It's just crazy because people truly believe that she looks better than she has ever looked. This is like, I can't go on my For You page without hearing somebody talk about Christina Aguilera and this amazing transformation. Now, would you believe me if I told you that Kylie Jenner allegedly has also recently undergone a full-blown facelift at 27 years old? Are we okay? What?
It's my belief, based on this photograph, that Kylie Jenner has had a facelift at the age of 27. Why do I think that? I'm a plastic surgery enthusiast, and once you know the signs of facelift, you can't unsee them. This is the ear right here. I don't know if you can see the pull here. Those are the telltale signs of a facelift. We saw in 2020 that Kylie was looking very full in the face. Her filler practitioner had allowed her to be overfilled. Fast forward a few years, at the top of 2024, we saw that much of this facial filler had been dissolved.
This is such a perfect example of when you get that filler removed. Obviously, she has much less filler in her cheeks. You can see there's this like rippling, and under the eyes as well. Her skin just doesn't look as taut as it did before.
We see that where we can see from the emptiness, the tear trough area, and just a general deflation on the Kardashian just after that Paris appearance. She said she was going on a filler removal journey. Now, people laughed at her and said there's still filler in her face. The only filler that was really there was in her lips. At the time, I wondered why she'd done such a comprehensive dissolution of the filler, but now it makes sense. She was preparing for a facelift, and it's often best to dissolve filler before a lift.
There's a lot of people that have openly talked about and discussed, specifically online, that they are not doing any sort of facial fillers and they're going to wait for the premium moment to get a facelift at 50-something years old. Do you? First comment I'm telling you guys, do a video on the signs of a facelift. I'm so glad I never dabbled in filler. My goal is straight to the facelift. Same with Adriana Lima. If you check her recent pictures, she 100% had a facelift, and it's very visible because of the pixie ears. Pixie ears? That is kind of cute. So Kylie recently went to an award show, and after seeing that, I was slightly skeptical in terms of the idea of a facelift, but at this award show, there were all these pictures, and oh my God, you guys, it is she doesn't look the same. It is a full-blown facelift at 27.
I'm starting to feel bad for Kylie Jenner because I don't think this girl likes herself one bit. I thought I was tripping because now I'm seeing all over the internet of her new like alleged facelift, and I was like, why is she getting more work done? Like, honestly, she looks fine. And I was like, there's something different like about the...
This is insane. These pictures that I've seen on her Instagram, I had to look and I stared and I zoomed because my goodness, she looks like a porcelain doll. Everything that somebody had to say about her face previous from those fashion shows where she was missing the filler, she has gone, oh, you don't like me? I'll change it, no problem. It makes me genuinely sad. Just like this girl said, I don't know if she likes herself, but I really think that scrutiny and being in the public eye and being told that this isn't good enough, that's not good enough, you look bad, you look good, it's just all too much for any normal person to handle, let alone somebody who's been in the spotlight since they were a child. It's so insane that we covered in my last video regarding Kylie Jenner how much she didn't want people to talk about her looks. Don't talk about me. Why do people feel like they need to talk about me? When she literally morphs into a new person at every single event. She changes herself left and right and up and down, and all of these trends do have a genuine effect on other women. People are gonna wonder, how do you look like this? I feel like because of Kylie Jenner and definitely the Kardashian movement and how they've glamorized work, plastic surgery, and fillers over the past few years, we are moving into an era where those who were influenced, who did decide to overfill, are now choosing to remove that sagging skin with a facelift in their 20s.
Here's why I think we'll be seeing a lot of early, subtle facelifts in 2024. And it has to do with the beauty trends that were popular in 2023.
Exactly.
Those being buccal fat removal and medical weight loss. I will say it again, facial fat is good fat. With the rise of these two trends, we're losing fat in our face, and that can lead to premature aging. Fat in our face is supportive, especially in our mid-face. With rapid weight loss, we see flattening of the cheeks, which leads to deeper folds below. With buccal fat removal, we're losing some of the support in our lower face, which can also lead to jowling down the road.
Bro, I've lost a few lbs, and honestly, I can see it so clearly in my face. I feel like instantly it makes me look older, and I'm like, do I gain the weight back? Like, what do I do?
Celebs were the leaders of these two trends, and that's why I think we're going to see them going for early, subtle, quiet facelifts. I'm already seeing more chatter about these mini lifts that are designed for younger people, less invasive, less downtime, which celebrities have been doing for years.
Facelift in your 20s or 30s is insane. Tell me about it. You're definitely right. Check out Lindsay Lohan recently and her facelift. Oh my God, that is so true. Do they think we don't notice? Now, this young man went and got a full-blown facelift at 27. He was also somebody who was a victim to the overfilling, and I just cannot believe the work that he got done at such a young age.
All right, so facelift at 27. That is young. Oh, whoa, things look quite pulled there.
Oh, that's
I know
elevated.
they're going to settle, but that looks quite exaggerated. His brows, I would argue, were in a very...
Oh my... Without the filler, bro, can we not agree that he looks good? Why did we have to do that? Take me out.
Very natural position to begin with, and they were already quite lifted. So for...
Okay, you guys, we were almost hitting that egg girl face, you know what I mean? Like with the egg girl fillers in the cheeks, like that is kind of crazy.
But it was a good idea to go in there and lift the brows to this extent.
It's lifted.
I think is problematic, in my humble opinion. And he also had a full facelift, it seems, and they dissolved the filler. So there's a point where things just are overdone, and I think he may have reached that. And also when people are getting these larger plastic surgeries at this age, I think it's problematic for the future because that will limit how many more times a surgeon can go back in there safely.
Just looking at those videos, I cannot believe how absolutely intense a facelift is. And more than anything, I would be so worried if anything went wrong in a procedure like that. Now, I know this facelift thing looks like a lot, but I mean, I think all of the options are relatively intense. Like, there's no such thing as an easy peasy facelift. So like that previous video, she mentioned there's something called a mini facelift. Sounds pretty easy, right? Like a more more non-invasive facelift because, you know, at 27, we just have so much extra skin to deal with, right? Now, even though it sounds like a great idea, apparently a mini facelift is just where the doctors do half the work and you get half the results.
Don't fall for this scam in plastic surgery. The mini facelift is one of the biggest scams in plastic surgery.
Dang.
Mostly because the term mini doesn't actually mean anything. It's a marketing term that basically makes it easier for your surgeon and shortchanges you on an actual good result.
Dang.
The incisions are almost exactly the same. There are some modifications here, but a mini facelift doesn't mean less incisions. Big chance for deformities like this one here. It's called a sweep deformity.
Oh my.
Tissue's not supported properly, you can end up with something like this. And mini facelifts don't release that deeper layer called a SMAS, which needs to be done to give you the most natural and longest lasting result.
So I guess it's sort of like a band-aid fix. I fell for this scam and I regret it and paid so much I should have just done the full facelift. If you're still getting cut open and then you're not even getting the full result, why would you opt out to do something like this?
Is it worth getting a mini facelift?
Mini lift is a trend, exactly the same as threads. So the patient are afraid to do the real surgery, so they're asking for the mini facelift, and some doctors say, yeah, of course I will take your money, create a scar here, pull a little bit of your skin, and you will be happy. The real thing is you will be happy for 6 to 9 months.
Are you kidding me? 6 to 9 months when you still have to do all of that healing, all of that downtime, and then it doesn't even last?
Then all the results will be gone, because the real facelift need a proper dissection to pull back all your structure back in place, like your deep layers, like the muscle, the SMAS muscle, the deep fat compartment and everything. This is a real work. And at the end of the day, it's the same scar. It's just the scar here. So if you do a mini face or a real facelift, it's exactly the same for you. Same scar, same downtime.
All right, so I guess that one's off the table. Now, like mentioned there's also something known as threads or a thread lift. In a thread lift, very thin, tiny, dissolvable threads with little barbs on the end of them are inserted into your face with a needle. Honestly, it's grossing me out just thinking about it. The barbs or the cones that are on the threads hook into the skin tissue, allowing the surgeon to pull and lift sagging skin into a more youthful position. Now, when I think threads, I think like the thread off your t-shirt when you're like, let me just yank that off. Over time, it's also mentioned that these threads stimulate collagen production, which does add volume and skin texture. Now, as awesome as these sound, they apparently only last a year and they can look botched. It's honestly one procedure that so many plastic surgeons recommend against. Watch until the end to see incredible results. Look at how they are inserting them with a big needle and the thread comes. No. See, I think this is really weird. I mean, the snatching has been snatched, but honestly, watching that really does make me sick. Like, you guys, we're not dolls. We're not little rag dolls that you can stitch together and pull up and pull down. No. Now, I found this TikTok where this girl is talking about how much she loves the threads that she put in her cheeks, but I couldn't help but notice the comments. Do not do threads. It doesn't last, and the sagging gets worse once it wears off. It never lasts with PDO threads. Best to just invest in the surgery. So happy you had a good experience. I paid $1,700 to have the worst trauma of my life, including nerve damage. Yours look great. Well, that's not very convincing. I don't know if I like those reviews.
So thread lifts were something, when I started my practice back in 2004, it got really popular. And people were like, wow, you can take these threads, which basically they're barbed sutures. You know, you could run these barbed sutures on the skin and it would look like you're lifting the neck or the forehead or whatever.
You're reawakening my trauma from when I got threads.
Oh, there you go. And people go, look, these things are amazing because you could run this under, it's not surgery, it's a minor operation, whatever.
And cheaper.
It's so amazing. And the problem with these threads is that at the time they were permanent, people would literally get a 6 to 12 month result from it. But years later, they'd have these permanent threads sticking out through their skin that they would come to see me and like, oh, we got to clip it off and stuff like that. People realize this doesn't work. And so they abandoned it. And then what happens is a decade goes by, a new generation of doctors come around and these companies say, oh, I've got this new thing called threads, barbed sutures. They go, really? What's that? Well, we put these little holes in it and then we run on the skin and look at how amazing this is. And the doctor's like, I've never seen anything like that. This is revolutionary. Let's sell this.
There have been a lot of clips circulating online of Kylie Jenner and other celebrities where when you turn your head as well, some of them you can see the threads under the skin and it is this very odd pulled look. It just does not seem like a good idea. Let me know in the comments down below if you guys want a full deep dive on threads. I have done partial research understanding this, but I had no idea there was a black market underground threads division. I need to investigate. I'll put on my hat. Now, moving on, there's also something known as a ponytail facelift. I think from the name you can already tell what they're up to when they give you that ponytail look. Allegedly, this is what Bella Hadid has undergone to create that beautiful fox eye lift that she's got going on. Like, it always looks like she's got a really tight Ariana Grande top of the head ponytail going on.
The ponytail facelift, which is a mini deep plane facelift that has your scars and your hairline, you can literally be at dinner the next day. Amazing, I know, right?
Wait, that's insane.
Bella Hadid, allegedly,
Allegedly.
she has had a ponytail facelift, which means she's lifted all of this. It's not that she had saggy skin or anything, but when you're younger and you move your tissue up, you're creating a new face shape. And that's what gives her that almost elf-like, they call it fox, you know, lift.
The only issue that I see with this is, just like a lot of plastic surgeries, this is a very clear trend. Like the whole fox eye effect. I have seen so many women undergo this procedure, and it is very dramatic. It is very intense. And is this really going to be the look in the next 5 years? I'm not sure. Somebody from the future tell me. All of these facelift types share the common goal of restoring a youthful appearance by reducing sagging, signs of aging, and wrinkles, which is crazy to think that anybody under the age of 40, 50, 60 would have any of these issues. Now hold on to your chairs, because facelifts cost anywhere from $10,000 to $15,000, with rumors of even this ponytail facelift costing $30,000, which is insane. So maybe after even hearing that price tag, you're throwing the whole idea of a facelift completely out the window. But wait, I have a way cheaper and easier option for you guys. If any of you guys have been watching my channel for any period of time, you know exactly what I'm going to tell you. In plastic surgery, there's always this sneaky non-surgical BBL, non-surgical rhinoplasty, or in this case, a non-surgical facelift. This is where doctors or nurse injectors will give you the effect of a very invasive plastic surgery, such as a rhinoplasty, with something called dermal fillers. And you guys already know how I feel about fillers. But now this is more suitable for people with mild or moderate signs of aging, and it provides a quick and relatively low cost option, but of course it is far less effective, way less. And not to mention the fact that Botox is a neurotoxin, and also fillers in general, they never dissolve. They end up causing pillow face if injected incorrectly. In my opinion, most of the time they look very unnatural and also could potentially cause vascular occlusion or skin death. Click here to watch one of my older videos to get you up to speed. But once you're done that one, come back to this one, right? 7-syringe mini liquid facelift. Properly placed cheek, chin, and jawline filler can look natural, adds beautiful structure / definition, and creates the illusion of a more lifted look.
Filler results like this are the reason why some people call it a mini liquid facelift. In her after photo, it looks like I'm taking my hand and just pulling her face up. She looks more defined, sculpted, and lifted.
Sure, it looks fine, but tell me you're not gonna get addicted and go back in 3 months to get a little top up on your lip filler. More please, sir. More filler, please. I'm hungry. But this is something called necrosis, which can occur if you do have dermal filler injected into a blood vessel or sometimes an artery. It can cause blindness if you put it around your nose or your mouth area. And here this girl got lip filler and ended up with skin death on her upper lip, which is very, very scary and why I don't think I would ever do fillers. So even though that girl was very, very happy with the results of that liquid facelift, this doctor doesn't seem to agree. You cannot lift the face with fillers.
All right, guys, here it is. I know a lot of you had questions about my previous post about fillers versus facelift. Look, this is your beautiful Courtney Cox. You can see on the left side, this is her before, right? In the middle is when she had fillers done. Why did she have fillers? Well, I guess she wanted to avoid surgery, or she went to the wrong doctor. I don't know, it beats me. But look at her. She doesn't even look herself. Her face is blown up like a pumpkin. All right.
He's gonna hold her back.
She even came out and said she hates the way she looks. She looks different. She doesn't look like herself. So finally, she had her fillers dissolved. And over here, that's her now after having her fillers dissolved.
Look at how unbelievable she looks. She looks like the same person. She looks like she's just aged a few years, but she is the same Courtney Cox that we all remember. Someone tell Madonna. No, nobody talk to Madonna. Let her do her own thing. Why do celebs get bad doctors? They all have the resources to get the best of the best. Don't even get me started. I should make a whole video dedicated to celebrities getting bad doctors. Like, who are they going to? Now we've arrived at this part of the video where we have to discuss the pros and cons of the facelift. Why we should maybe think twice before spending $10,000 just to get our faces cut open and yanked to the back of our skull skulls just in the name of beauty? One of the main reasons is it's kind of just like getting veneers. You spend all of this money for the veneers to only last 10 to 15 years. The facelift is no different. You spend all of this money to go ahead and get a facelift, and they only last 8 to 10 years maximum. Then you gotta go back and get another one? Now, there's no harm done if you choose not to go ahead and get another facelift after that 10-year mark. The signs of aging will just resume and your face will begin to go back to the way that it was before. Which sounds so sad, like spending $10,000 just for those results to fade away. At least with the rhinoplasty, you got that new nose for life. But the reality is that we actually cannot stop aging ever. It is inevitable. This is why getting a facelift in your 20s and 30s is so insane. You're gonna go get another one in 10 years?
If you're in your 30s and already thinking about getting a facelift, let me stop you before you make the worst decision of your life.
Okay.
People are coming into my practice asking me if they need to get a facelift at 33, 35, 36, and I'm about to lose my shit, yo. And don't be fooled. They're marketing it as a mini facelift. A mini facelift is still a facelift.
Yep.
It doesn't matter if you're just cutting from here, or if you're cutting from here, or if you're also cutting from here. You're still getting a facelift.
Yep.
As a cosmetic dermatologist, you should not be thinking of your face in the now, but rather you should be thinking of your face in the how it is going to age, i.e. the journey ahead, because you only have one face, and unfortunately or fortunately for you, you gotta live with it. And if a facelift has a 8 to 10 year lifespan, which by the way, you still need to maintain, if you do it at 35, hypothetically, are you gonna do it at 45, 55, and then 65? What the hell are you gonna look like by the time you hit 70? You only have so much skin, number one. But each time you get a facelift, your face is going to shrink. They take out some of that tissue underneath the surface of your skin. And on top of it, your bone structure is also shrinking.
Bro, that is so scary. I'm gonna look like that little head guy from Beetlejuice. Like, don't even get me started. We're all going to look like Cher. My cousin got a facelift at 27. That's way too early. You guys, that would be if I got a facelift right now. Like, what are they lifting? Like, sure, you know, I got an 11 going on. Well, for me, it's not an 11, it's just a 1. Due to the immense amount of cutting that they do in a facelift and how invasive it actually is, it creates a huge risk for skin necrosis or skin death and even infection. Skin necrosis occurs when blood flow to the skin is compromised, causing the skin to die and often leading to scarring and really discolored skin on the face. This is a woman who had skin death after her facelift, and you guys, it is not pretty. Like, it looks so bad. And that amount of scarring, what are you going to do? And if you aren't taking good care of yourself and on bed rest immediately after the surgery, this scarring can be crucial and it can ruin the entire result of this facelift. And it's specifically if you don't go to the right plastic surgeon.
This client came to us in hopes of permanently concealing the scars left on her face from a facelift.
Awful. So she's getting the scars tattooed to try and cover up those scars. You guys, this is your face. And just like that doctor said, you have literally one face forever. You need to be so careful with who you trust. Now, this video we're about to watch is a doctor explaining a lot of the complications you need to look out for, but after a lot of research, I started to realize that a lot of times in a facelift, because it is so invasive, there is a huge chance for complications in general. So it's not even really about what complications arise, but when, because you never know what could happen.
Unarguably, the most trending topic, in my opinion, on social media when it comes to aesthetic surgery or plastic surgery is facelift. The reason being is now there's a whole movement towards doing facelifts earlier and earlier or younger and younger, which by and large I'm not opposed to. I think it actually is very effective.
But do you not, okay, can we just consider this quickly? Do we not think that by selling a mini facelift or selling a facelift as young as you can go, you know, in your 30s and your 20s, are they not making more money? Because then you have to continue to go back.
We do nose jobs in 15-year-olds. Why can't we do a more conservative facelift in a 50-year-old?
Okay, so he's not talking about like 20 or 30. He's talking about 50. Okay, I'm with him here.
The issue you need to understand is what are the main things that can go terribly wrong? And I kind of categorize them in the following things. Number one, you can get what's called a hematoma. You have surgery, you're in recovery, or the next day, and all of a sudden you get a massive bleed. The face has a ton of blood vessels, and coughing or high blood pressure can make one of them burst, and all of a sudden that's an emergency.
Oh, just don't sneeze. You guys, you can't sneeze, you can't talk, you can't cough. You need to just lay there, watch a Netflix show.
Is that the skin around the ear or in front of the ear can die or become necrotic. It doesn't get enough blood supply. That's why we don't want to operate on diabetics, people that have been smoking, or people with heart disease. Number three is that you can get nerve damage, because the right way to do the surgery, in my opinion, is to manipulate the underlying muscles, and nerves are vulnerable, and you could get damage to one of your key facial nerves. And number four is they pull just simply too tight, and you get pulling effects later, causing thicker scars, a pixie ear, and frankly, just a very poor cosmetic result. Make sure you do your homework.
Absolutely. Well, I think these next facelift results, I think the doctor pulled a little too tight.
These facelifts are going viral on TikTok. There was a doctor named Dr. Kim
What is
who posted a
happening?
lot of his before and afters of facelifts. Thing is, his patients afterwards look nowhere near recognizable. You see this man right here? Here's a close-up of his transformation. One thing I want to know is he putting, when I show you the other photos, is he putting makeup on all of them?
Don't say that.
Because all of them have like really dramatic makeup in the section.
They look completely different. It also has to be noted that I think he's taking these videos and pictures of them like directly after surgery or maybe like a week after. So they're still rather swollen.
Like you can see here, this lady, she looks nothing like she did before.
No.
Maybe that's the point, but you'll notice that they all have like very similar face shapes. Here's another one. And their eyes
Yeah, it
are
all kind of
like
creates
so
the
much
heart
bigger.
face shape.
Now, people are saying maybe face looks look a bit unnatural due to it being so close to like when they got them done. And he's posting these videos like right away instead of waiting. I mean, you could still see, you know, surgical scars and stuff like that on their heads. It doesn't seem like he's giving them any downtime for them to rest, heal, and like, I feel like when you have a facelift, like you'll eventually like lower at least a little bit. Yeah, this is the doctor. Clearly you can see his videos there.
Dr. Kim. I don't know, maybe it is the desired look. Maybe it's like, let's pull the skin so tight so we don't have to do it a second time, but these results do look a little strange. But that's just a perfect example to go to a plastic surgeon who creates results on other people and the type of results that you want for yourself. You ultimately have to do a ton of research to decide where you want to go. And also making sure that that plastic surgeon takes really good care of you and keeps you safe in case any of these complications arise. Now, because they're working on the face, they're pulling the muscles, they are around the nerves. The nerve damage thing is like pretty serious. Nerve injury can result in facial weakness, drooping, or loss of sensation, particularly around the cheeks, mouth, and forehead. It's stated that these complications are temporary. However, the people that do experience them, it's stated that the complication of nerve damage can be temporary, but some patients report after getting a facelift they are unable to smile or close their eyes due to the nerve damage. Although it is typically rare when working with a very skilled plastic surgeon, this is why it is so important to do your research. Just like any plastic surgery procedure, this is one to think very long and hard about. The facelift has been around for a very long time and they are constantly perfecting it. However, it seems like a bit of a stretch for somebody to undergo such an intense and invasive surgery for those results to only last 8 to 10 years. With all of those risks too, and then taking those risks every 10 years to maintain this facelift, it's crazy. For me at this point, it's kind of like a one and done. Like at 60, one and done. At 60, am I gonna care? I don't know. Facelifts are what they are. They've been around for a very long time, and there has been such a history of women that are older that decide to undergo this procedure, and there's absolutely nothing wrong with that. What bothers me so much about this facelift trend is that people who are undergoing this procedure in their 20s and 30s, it is only instilling this idea into ourselves that aging is not okay. That aging is a horrible crime and a disease, and we need to nip it in the bud and do it really early. And that we're not even really able to enjoy the pleasure of maturing and growing older without feeling as if we need to constantly be looking younger and better. But younger doesn't necessarily mean better. Why does somebody that is already so young need to strive to look so much younger? And what's even more insane is the dishonesty behind these transformations. Kate Beckinsale does not like people feeling sorry for her, and she's usually quick to let them know. When fans expressed concerns this year about her appearance, she accused them of insidious bullying. Anytime I post anything, I'm accused of having an unrecognizable surgery, using Botox or fillers, or being obsessed with looking younger. The 51-year-old actress wrote online, "I don't actually do any of those things." By being dishonest and saying, well guys, it's not Botox or fillers, you're not doing us any favors. You're not blessed or special by not getting work done and being so secretive about it. There's no harm in doing something for yourself and then just being honest about it. I'm over here sitting looking at Kylie. She's never once said anything about a facelift, never said any, she barely admits to the amount of filler that she puts in her face. I'm 27 thinking that I'm inferior because I could never look like that. And then the younger generation thinks, is there something wrong with me? Why do these elites look like that when they've never opened up about plastic surgery? I would never want my future daughter to ever feel as if she's not good enough exactly as she is because of this said beauty standard. These trends will come and go, regardless of how you feel in your 40s, 50s, and 60s. That's completely up to you. However, don't do anything because Kylie Jenner at 27 is doing it. It is just so not worth it. Like I always say, I only make these videos because I love you and I only want the best for you. Please make sure you do your research and you find the perfect plastic surgeon that will hold your hand and be there for you if you do decide to go through this facelift procedure. You never know what kind of complications or ups and and downs will arise, and you don't want somebody to just scurry away and leave you with scars. And remember, just because Christina Aguilera looks absolutely banging now doesn't mean she did not walk through the gates of hell just to look like that. You guys, imagine what she looked like 1 week post-op. It was probably crazy. If you guys did enjoy this video, you can go ahead and click here to find out all the reasons why you should think twice before getting laser eye surgery, or go ahead and click here to find out why you should never take Ozempic. I love you guys so much. Have an amazing day or night or whenever you're watching. Please don't forget to subscribe, and I want to thank you so much for being here and watching these videos. It means the entire world to me. I will see you guys very soon. Bye.